we need to look at the population on a whole, and not just necessarily as a segment that is my population per se, which definitely has, like, again, a lot of chronic comorbid conditions: diabetes, hypertension, kidney disease, cardiovascular disease. But let's talk about the country as a whole right now. There's like 100 million diabetics out there, and that's not even including type 1 diabetics. It really doesn't discriminate necessarily based on socioeconomic status. This is a rich person problem, a middle class problem, somebody who, like you said, is not even making $10,000 a year problem. It's pervasive.
Welcome back again. Another episode of Healthcare Stories with Healthcare Henry. Today we've got Dr. Stern and Mrs. Stern, a couple that you all want to know about. Holistic medicine. What is it? What are they doing in the community? And how are they giving back? Now we're here to find out more about them. How are you guys doing today?
We're doing great.
Awesome.
We're happy to be here. And Dale works fine for me. We don't need to get into this whole doctor business stuff. Dale's great.
Well, we got to start off with the doctor, right? Because people have to have a point of reference so they know who they're listening to.
I appreciate the respect, but Dale works great for today. Absolutely. Thank you.
Okay. All right. So Dale, I guess my first question, I'm just really interested. You guys, a couple, how long? How did you meet? What are we working with here?
You can tell them the real story.
How much time you got?
I got time for the real story. Should I lean back a little bit? What do we think?
Yes, lean back.
Okay.
It's been a long time coming, but most recently, I would say we've been married for 11 years now. I'm pretty sure. I hope I got that right.
You got it right.
Congratulations.
Two beautiful children that are 6 and 8. Before that whole wonderful story, Jen and I were together even while I was abroad in medical school. Really stuck it out.
Come on, tell them the truth. So we met when we were teenagers. Like, this is the truth. He's telling you, like, the more recent, the professional story. I'll tell you the real story. We met when we were teenagers. We dated for a month, and he was such a nice guy that I couldn't date him because my mom liked him.
This is gonna be like out on
my mom liked him. My mom liked him, and that was enough for me that I was like, I can't do it. So fast forward 10 years later, I got smart, realized nice guys are good guys, and we want to date nice guys, and we had all this chemistry still 10 years later. So
am I blushing?
Yeah.
Well, yeah, part of it is that. And then the other part of it is, like, now I'm wondering, wait, do nice guys really finish last, right? But you won the marathon, right? It's not a race. You actually won the marathon.
Yeah. We had to live and learn a little bit.
Win in the end.
Yes.
Oh, there you go. So now you guys are here. And 2 kids. You say 6 and 8?
Yeah.
Yeah.
Boys, girls.
We got 1 boy, 1 girl. And they are fantastic. They keep us busy when we're not busy with everything else. So yeah, it's a busy, good life.
So I have a 3-year-old. So any advice for me before we get too deep into this?
Oh my God.
Shoot.
You don't let them run the show.
Good luck.
Yeah. You got to set the tone.
You're the dad.
Yeah. You're the dad. Be in charge.
Yeah.
How do you manage that? How do you manage 2 kids, family, work-life balance? For people who want to know, including myself, how do you do it?
Great question.
Give up sleep.
Not true.
Any other ideas? Is there anything else?
I think like anything, at times you got to dig deep down into that well. When you feel like you don't have the energy, you really got to dig deep and just know that, that extra time that you put in, you're going to reap what you sow, and you won't screw them up too much as long as you love them.
So it's intention, right? So if the intent is there, then if you want to put good in, then you'll get good out.
Yeah.
That's just it.
I think every day we make the conscientious decision to prioritize each other, prioritize our children, even when it's like I'm exhausted. I've been at work since 6 a.m. Or he's been working overnight and coming home and saying, okay, you know what? Yeah, we could get fast food. We could throw something in the microwave for our kids. Like, we want to feed them good, healthy food. We want them to be involved in after school activities. And we dig down, find that energy to pull through for them. And it shows them that they're important and their wellness is important. And we sit around the table every night that we possibly can for dinner and have that family time.
Really important.
Phones away, all of that.
That's a lost art. It's just really, and I guess for me and so many people trying to figure this out, this whole, whether it be entrepreneurship or just crazy careers. And then of course, with us having children later in life versus our parents, I think the career work-life balance has gotten extremely difficult. And then I guess with you being a nutritionist, correct?
Yep. Nutritionist. Trainer. Yeah.
Talking about eating healthy, what does that look like? Let's start with children, right? So what does it look like? What are you instilling in them to kind of help forward you all's overall mission that we'll eventually get to?
Honestly, it is an ongoing, I'm not going to say battle, but it's an ongoing area that we focus on teaching and empowering our children to make those decisions for themselves, even when we take them to the grocery store, and teaching them about foods that we want to have in our home versus on occasion outside of our home is the first thing. So we don't bring foods in our home that we don't feel are going to be nutritious and growing foods for them. Like if they want to have like Cheez-Its or, Franken foods, to be honest, that are not necessarily going to serve them in their wellness on a day-to-day basis, we don't bring them in the house. That doesn't mean they can't have them at birthday parties or elsewhere, one-off when we're out. Like they want to have a Gatorade because that's what's being given out at the baseball game, like they'll have it. But if it's in our house, then that is kind of like a safer food that we feel comfortable with them having on a day-to-day basis. Foods that we make from scratch.
I think we try to lead by example.
Yes.
In that sense, like we show them too that like, hey, we try to do as much good as we can. And the odd time, if you feel like having a treat, there's nothing wrong with that either. Don't want to create a sense of deprivation.
Yeah.
And I think that, you need to definitely be persistent because maybe they like the broccoli on the 20th time, but just because they don't like it the first few times doesn't mean you don't stop serving broccoli. Eventually they'll come around and their taste buds change and their attitude changes. We have one kid who's really open-minded about trying new things, and another child who, she knows what she likes and she'd rather just kind of stick to that. But I think you can't give up on them either. Otherwise, they'll just be like eating chicken fingers when they're 30 years old. So,
and so that's how I am, right? Like, unless I'm going out for something that is like work related, I guarantee I'm gonna have chicken finger. It's pretty bad. But all of this kind of is super interesting to me, not only just from the food perspective, but also as we talk about holistic medicine or different types of medicine. It's not necessarily what I would call just pushing prescriptions, right? And that's medicine is food, medicine is life. Is that kind of the message that you all portray?
I think in a sense, yes. I mean, my background is more focused is allopathic medicine. I'm a MD, medical doctor. And I would definitely say, and I have a lot of patients out there who could attest to this, that there's not a lot of time spent as far as speaking with patients about food and nutrition. And, in some offices, they may be lucky they have a nutrition or a dietitian on hand to provide that counseling, which is fantastic if you've got it. But by and large, the encounters are quick. Doctors make compensation by volume, and it's easy to give a pill. And on the other flip side of the coin, Henry, it's easy to take a pill. There are a lot of patients, don't forget, who they say, listen, doc, just give me the silver bullet, I'll take the pill. Yeah. Because it's easy. Like, I don't want to give this up. Maybe not right now. So I'm good to take the medication as well. So there's all things out there for all kinds of people. And that's kind of like where there's the opportunity here with the knowledge that Jennifer provides, as far as it doesn't have to just be confined to like you take the medications. How do we figure out how to make this kind of more a lifestyle, just your daily way of living, as opposed to eating and moving and physical activity being something that is kind of like shoved down your throat. We're trying to do that by way of educating people, as opposed to like just writing it like a prescription that somebody has to do, making it feel very daunting and choring.
That's an interesting point, because you speak on something that I've been talking about on social media, because I'm on the business side of healthcare, right? And I think that is where a lot of people, and you just kind of fill me in from your perspective. You said that we as constituents or citizens, if you will, we don't get a lot of time with doctors, and doctors work by volume. Is this something you learned in med school? Explain it to me and us, because it's completely confusing how I went from 40-minute visits to 10-minute visits, and where we like, how does this even work? How are we getting healthy?
I am 100% inside of the hospital setting, but for my colleagues who are in the outpatient, where so much happens between a doctor and a patient, as far as building a relationship and trust, and seeing this physician regularly, what we learned in residency is here's your schedule, and you got like a number of patients to see today, and they'll start you off with maybe 8 to 10 patients, and eventually ramp you up. Why? Because these encounters have been squeezed into 15 to 20 minutes, maybe a little bit longer for establishment of care meeting, which would be like an initial meeting, but by and large, this has happened because compensation has gone down or remained stagnant for these outpatient encounters, which means that doctors need to see more people in order to maintain their income. And I don't say this in a way that, like, I don't want to come off like the doctor's trying to be selfish. Like, sure, private practice, these guys got to keep the lights on. They've got costs. They've got MAs who work there that do all the paperwork and all the important stuff in the front office.
Their costs have gone up, right? Like inflation, yeah. Their costs have gone up, but their reimbursement is going down.
Right. And then they're challenged by the insurance companies. But when I was a resident, I had the unique opportunity of not caring about that stuff, because right. I mean, I was on a salary. When I came across patients who expressed a certain interest to be like, doc, like, you got to spend some time. Like, I want to do this the right way. You've now told me that I have, for example, I have diabetes, and I'd say, yeah, it's in the early stages. I think that, if we put in the time now, we could get a lot accomplished. And I would like come back and tell Jen about this one guy. I'll never forget him. He was so concerned, and I would work through my lunchtime with him when we would sit and talk and really put in like 45 minutes to an hour. And sure. And he was listening. He was astute and attentive, and he did so good over the course of several months. And it was a testament to, if you have the time and the energy and the inclination, both patient and doctor, as a partnership, you can do incredible things. And he, as a young man, was upset enough about this that he really wanted to do something, and I felt great because he trusted me to kind of give him that guidance. But it would have only happened because I made the time, which most doctors don't have the luxury of doing, just based on the way that their compensation structure is set up. And again, I don't want to fault the doctor, because at the end of the day, who's paying the bill? The patient is either out of pocket as fee for service, or most of the time it's an insurer.
So I guess my question, and many other questions that I get, because I get a lot of questions about this insurance portion of medicine. And it seems that we've had so much fraud, right? Whether it be from doctors or hospital systems or whatever you want to call it. Is this the way of the insurance company saying, look, I don't trust you guys. This is what it has to be? Because I'm seeing they're even limiting, or they're telling clinicians how long someone can even have anesthesia for during surgeries. So I just want to understand, are we on the same page here? What's going on?
We are a lot of times not on the same page with the insurers. Okay. And it's been a major challenge. And so much so that my colleagues who do some of the admin stuff, not the direct patient care stuff in the hospital, are on the phone with these guys all afternoon dealing with denials for patient stays, when we know darn well that they require hospitalization because their condition dictates it, as far as what we decide based on our own clinical judgment, which should be worth something. We have to go through a lot of school and training to make those decisions, right?
And you also have the patient visually in front of you versus someone on the phone who doesn't have eyes on the patient.
Right. Yeah. Right. And so there's that. And I will say, doctors are not innocent. There have been a few bad apples to spoil the bunch. There's been Medicare, Medicaid fraud committed by, a number of people. But at the same time, it's like, you sent me the article over the summer. It was like a whole expose on, the
Medicare, Medicaid, that's from our insurance company.
Yeah. Oh, okay. So basically, doctors were wondering, like, why is it that Medicare is going to cut reimbursement by like nearly 3% to doctors? And we're like, what's going on here? This is crazy, because there are a lot of practices that take on like 25% of Medicare patients, right? Just kind of helps to stabilize some of that income structure as far as their patient population is concerned. Sure. And so, like, where's all this coming from? And it's like, lo and behold, some of these insurance companies, the big ones, I won't name them, them. Remember when they were sending out
nurse
practitioners?
Yeah, nurse practitioners to test for specific conditions related to diabetes. And they were saying that these patients exhibited this certain condition that's like a retinal, like eye condition, which is extremely rare.
So diabetic retinopathy specifically. They say the patient has they're a certain age and they have impaired vision based on my evaluation, or this free home evaluation that these insurance companies sent out their nurses to go see people. And then what happened was Medicare was providing a much larger reimbursement to the insurance companies to collect for those diagnoses, when in fact most of those patients had cataracts or some other alternative
no condition, no diabetes even. It was like, you can't have this condition if you don't have diabetes. So it just didn't make any sense. So this was all exposed this past summer of 2024.
Was it like to the tune of like $50 billion or something crazy like that?
Yeah, that the insurance company frauded Medicare.
So
now they got to make up the money somehow.
So they go after the doctors, which to me is just kind of wild. So, it's a
vicious system.
It's no love lost there. Yeah. But people need to have, insurance in this country. It's still important, because without it, most people could not, afford to come into a hospital or go to the outpatient setting. In fact, there's some policies set up where it's cheaper for people just to go to the hospital. They can't even like hook up with a proper primary care doctor.
So that's interesting. That's extremely interesting. I'm going to tell you why. So I'm on the business side of it. One of the things that I tell people is insurance is tricky, because, and you just correct me, because this is just the business side of healthcare, right? Ideally, a person doesn't really need insurance. And I'm going to tell you why. You only really need insurance in the event you get something catastrophic. Correct. We're talking cancer and you need chemo. We're talking renal failure to some degree, and you need dialysis. You need some type of either ongoing procedure or something that's very expensive that you cannot afford. One of the biggest issues, and then you guys can kind of help me with this one too, particularly with this administration that we have, is they don't really understand what indigent patients mean. And I see that every day throughout, right? And so I'm wondering, even at the hospital, you're the doctor at the hospital, are you even seeing if the patient has insurance or not? Like, is that something that you even think about when you're seeing somebody?
Oh, okay. Well, I have.
I'm just curious here. Just curious.
I work at County Hospital in Phoenix. Okay, that's where I'm currently employed. So to me, it's almost inconsequential as far as the way I'm able to treat a patient in hospital. I'm not concerned because my compensation is mostly more or less salary driven.
Sure.
Do I still see these patients who are fee for service who wind up with a diagnosis of end stage renal disease and going on dialysis and getting covered by the government to pay for it? Yep. Nothing's changed there. Even with this administration, they're still getting coverage. Do I still see people like getting surgeries and getting all the care? Yeah. They get it. And I think that they do a pretty good job at my hospital as far as providing that for people who have limited resources. But with that being said, I tend to agree with you. Nobody has a crystal ball, and you never know when you're going to need it. Better to have it and not need it than vice versa, as they say. I think that nobody can really anticipate, what's going to happen. You get in a car crash, they're still going to treat you, but it would be good to know that you don't need to sell your house, to cover that hospital bill.
There is what people most don't know about. Was it EMTALA?
Yeah, EMTALA guarantees that you will be seen and provided with medical care, regardless of what your background or what, any of that, your insurance,
your status in the country.
Yeah. So you will be, at the very least, be stabilized.
There you go. Stabilized, but not cured. But they will at least stabilize you.
Well, cure is a relative concept. I mean, I think that there are challenges in and around what patients' expectations are, right? A lot of people think that they'll come in to the emergency department, get patched up, and it's like, you haven't been doing your part as far as seeing a doctor over the past few years. You coming in, you've got advanced stage kidney disease or heart failure, or your blood pressure is through the roof. You say well, what's the deal now? I'm leaving the hospital with 6 medications. It's like, well, we can help to keep you compensated, but cure, that may not be a reasonable goal, right? Maybe you need a new heart. If you don't have insurance, you're unlikely going to get a new heart. If you're in this country, maybe not legally, you're going to be limited to what you can get inside this country, right? So maybe you'll get chemotherapy, as I do see some patients who are, from elsewhere here in the United States under, a status that's not necessarily permanent or semi-permanent. They'll still get chemotherapy, but maybe they're not getting a bone marrow transplant unless they can afford it out of pocket. So I think that there's a lot of variability, and I think that there's a lot of gray area when you discuss, these things. It's not all just one way or another per se, but I would say that by and large, I would say that, the community at the end of the day still has that safety net at a hospital where I work at.
And so with you all, because I guess now that I'm hearing your perspective, I tend to agree with you. And I'm wondering, even going back to the shortened doctor visits, how can someone truly get the necessary attention that they need when inevitably at this point, if I used to see a doctor for 30 minutes and get a true comprehensive, you talked about the initial plan of care, right? We do that all the time. That's your initial. And so if they're not getting true comprehensive treatments, they probably are going to get more people through the hospital. And if we have people in America who are not funded they don't have insurance, the insurance or the government is then having to bail out hospitals because you can't have a community without hospitals. You guys are the perfect people to have this conversation with, because ideally, if there was no insurance and we had to live off the land, or we had to be holistic people, how do we do that? What does that even, where do we even start? Because we got Google, we got ChatGPT.
Yeah.
You ask me, it's always wrong, right? It's just, you have to know what to even put in there. So at least, can you kind of start us on that? We want to go on a journey with you all today.
For sure.
Can you walk me through what this looks like?
I mean, that's what motivated us to start our private community, because we know people are not getting the time with their doctors that they need, and they're lacking, and they need the education, and they're looking at different sources that are not reliable. Whether it's influencers on various social media sites or ChatGPT or Dr. Google, and there's a lot of mixed messages, wrong messages, and misinformation. Exactly. So that's where we try to bridge the gap and fill in the holes for people who want to take their health into their own hands, want to take preventative measures at a lower cost. Our membership is not meant to gouge people so that they feel like they're not getting the value that's there. Our membership is there to lift people up so they feel supported, learning how to eat out at restaurants, learning how to eat on the go, food shop for their families, how to walk into, whether it's a gym or their home gym, or just do body weight exercises on their own, and guide them through these lifestyle changes, because all of that matters. So we're trying to help people to be less reliant on medications when possible. Obviously, there are certain situations where medication is necessary, but there are measures that you can take involving your lifestyle on a day-to-day basis, whether it's how many hours you sleep, how many steps you take, what you stock your fridge with, right? What you order at a restaurant, because we're not going to say, okay, everything needs to be made from scratch. That's not realistic for people. So how do you put food, what food should you order from a restaurant, right? What should you prioritize on your plate? What should you take with you to work when you want to eat, or in the cafeteria, right? All of these little decisions that you have to make every day, the more you know about what to prioritize, the more empowered you will be, and you will take that control and do what's best for you. It's not about being perfect either, right? Nobody is perfect, but the closer you can get to that, like we say, like 80% lifestyle, where 80% of your lifestyle looks like you are on track for a healthier, higher quality life. We're working towards longevity. So not just living to 80 and saying, okay, I made it, living to 90, I made it. But like, can you get up and down the stairs? Can you get out of bed? Can you sit on the toilet at 80, 90 years old? Like that's where you need to start in your 20s, 30s, 40s. That's the kind of lifestyle you want to live.
Yeah, it's learning how to make good decisions for life. So like Jen said, that you can lay down some insurance on trying to create longevity for yourself, living well into those years that come up at the end, the 70s, 80s, and if you're lucky, 90s. Hopefully, living well in that decade.
Yeah, and not trying to follow every trend that's out there, because those don't stand the test of time. They're not sustainable as a diet necessarily, and you don't learn anything from it, right? You're like following blindly, whether it's like a detox or elimination diet. And what have you learned at the end of the day? You've essentially probably screwed up your metabolism for a period of time and sent yourself on a yo-yo diet. The education component is really what's going to drive you to stick with something for long term. You understand the benefits.
Can you speak directly to a specific community, right? Because I'm going to say you guys are not necessarily replacing insurance, but your motto is more of like a supplement. Is that fair?
Yeah, absolutely. I think it's kind of just, we're like added value.
Sure.
You still have to see your doctor. You absolutely should. I do not recommend otherwise. Like, we are not a substitution. We are complementary to those important encounters to check in and make sure that you're doing well in that respect. But what we are that education component that is reliable, credible, where you get that education over just the prescriptions and the medicine part of it.
And then the motivation that goes along with that, because, you may visit your doctor every 6 months, and in between those visits, what keeps you going? What keeps you driven to want to lead this healthier lifestyle and to make these changes? And what keeps you on track is having that community where, okay, we're going to have that Q&A, that monthly check-in. We're going to have a constant chat of other people who are like-minded, who are supporting you and lifting you up. So there is so much more involved than what you would get even if you saw your doctor every 2 months, right? That's the wave that we see healthcare going.
So in that instance, is it affordable? How much is it?
Our community at this point in time, 2025, is at $29 a month, which can also be covered by your HSA funds, right? Because we are eligible if you have a metabolic disease, if you need to lose weight, you go to your doctor and your doctor says, yeah, you absolutely do have one of these conditions. There you go. You have access to your HSA funds to cover a $29 a month fee. That includes having a nutritionist, having a fitness trainer, having a doctor that will provide the support that you need to really guide you through making healthy lifestyle changes.
Yeah. And really, again, just to really drive it home, education is so important. The one thing that we talk about a lot, especially with my patient population, is health literacy. It's lower socioeconomic population, a lot of chronic comorbid conditions, and so much of it stems from a lack of that health literacy.
That's interesting. Health literacy versus economics, right? When we're talking about eating healthier, how can everyone afford to do it? Right? We're talking.
Glad that you asked.
Break it down for us.
This is a great question, and we're excited to discuss that for sure.
It is a problem.
It's a huge problem. It is probably the problem. It is the problem. It is the stem, really, of the problem. And again, like Jen said, there are some people who really don't have a choice. They do require medication, but it starts somewhere, right? It starts with those eating habits, habits with fitness. But the food is such a big deal, especially, again, referring back to my patient population. You can feel full and spend a few dollars less, and maybe it's not going to be as healthy. It probably won't be as healthy, or you're going to have to spend more money to be healthy, but maybe you may not eat as much in that day, at least maybe not feel full. So it comes down to, what is it that I can afford? What do I feel is going to give me value as far as getting through my day to day? Because that's how far I can see it, or maybe over the next few days.
I don't know how to cook, and I don't have time to cook, right? That's where, we've partnered with a company called Prado that is changing the face of food in America. And what I mean by that is that Prado is given access to people with funds who they have in their HSA or FSA account or EBT, to be able to purchase meals that are already made for you that have been deemed healthy for your metabolic disease or for weight loss or other chronic conditions. And you can pay for that food using your HSA funds, your EBT card. This is game changer.
It's huge. And again, if people are not familiar with the term HSA, FSA, these are pre-tax dollars that are deducted on your W-2 that are allocated into an account that you can use for health-related expenditures. And what Prado is doing is allowing you to purchase foods that could be, prepared foods through like qualifying restaurants. Again, going back to what we initially discussed was, this allows food to come back and be medicine for people, right? It takes all the brain surgery out of it, all that complex decision-making that some people need time and education to ramp up to so that they can be self-sufficient. This is also a way for people not to feel intimidated or concerned about what am I going to eat when I go out. How do I make this healthy? Because I've seen people turn vegetables into unhealthy meals, right? Like that, it can be done.
Yeah. So I guess for me, there's a company in Atlanta. This company is called Gooder. Have you all ever heard of Gooder?
I don't believe so. No.
So this is a pretty interesting concept, because what they do is they go to, whether it be ball games or restaurants or whatever, and they're all over the country now, but they were actually started in Atlanta by a young lady by the name of Jasmine Crow. And I met her maybe 15 years ago. And what she does is these restaurants, these ball games, they have excess food that they usually just throw away. They now give to her, and she gives to people in the community that need to eat. So, and the reason why I bring that up is because even when I hear what you all are saying, whether you're using HSA accounts, whatever that might be, to me, in my mind, that's still middle class, right? That is not necessary. We're talking about how can we actually help people. The people who listen to what we talk about, they're not middle class. They are my constituents. You're talking about county hospital. Those are people what we would call Medicaid constituents. They make less than $1,400 a month. How do they do this? Like realistically, how can they do?
Well, Jen mentioned that it's not just limited to HSA.
So EBT cards. We've seen that people can use those at grocery stores, and you can also use an EBT card for this. And then we're looking at other options in terms of getting Prado cleared through. It would be nice if it could be cleared for Medicare, Medicaid subscribers, right? So that your food is your medicine.
Yeah. I think it's
we're trying to open the doors.
Definitely it's definitely going to be a breakthrough, despite some limitations, getting right down to people who, like you said, are having the hardest struggles out there. But I think it's definitely it's one of these things where we need to look at the population on a whole, and not just necessarily as a segment that is my population per se, which definitely has, like, again, a lot of chronic comorbid conditions: diabetes, hypertension, kidney disease, cardiovascular disease. But let's talk about the country as a whole right now. There's like 100 million diabetics out there, and that's not even including type 1 diabetics. It really doesn't discriminate necessarily based on socioeconomic status. This is a rich person problem, a middle class problem, somebody who, like you said, is not even making $10,000 a year problem. It's pervasive, and it has a lot to do with the fact that our food these days is, a lot of it is unhealthy. The way that it's either made or procured, or the way that it's made up in a restaurant. Restaurants are not in business to make food healthy. They're in business to make food taste good. And there are a lot of people out there who, they're just eating, and they basically feel that, well, there's no good options out there. I'll just, eat whatever's convenient. And so it's this vicious cycle. So if all of a sudden there will be restaurants that will be more and more available, that will have a menu that includes, let's say, for example, diabetic friendly entrees, well, then you're really getting to the stem of the problem there.
And we're talking about entrees that are less than $10. You can't go to McDonald's for less than $10 now. So while these fast food options are very pervasive and accessible, they're not cheap anymore.
They're not. You're absolutely right. And so I guess, and the reason why I kind of harp on nutrition over fitness, because for me, I feel like fitness is something you can do, right? I think we put a lot of emphasis on social media fitness, where it's like, you've got to run 10 miles or be like David Goggins. But the reality of it is, you don't need a very expensive gym, right? No. Push-ups. I used to wrestle. I used to box. For us, it was push-ups, sit-ups, pull-ups, and just jog. Literally, that was it, right? We weren't lifting weights, so we couldn't gain weight. Yeah. So I'm less concerned. I feel like anyone who wants to, for the most part, can kind of zero in on the fitness part, unless there's some other medical condition that's more of a mental or psychological thing. But the food portion, and the reason why, as an African American, I really wanted to have this conversation with you all. You spoke about diabetics and how this looks for a lot of us. You all seem to have figured out a way to truly tap back into a community that, in my opinion, has really been forgotten about. And with what you all have done, to me, I'm excited, and I actually want to figure out how I can help do it. I want to figure out how we can help take it to the next level.
We love it. I think that, listen, it goes back to the whole idea. It takes a village, right? You got a great idea. You got somebody who kind of fleshes out. You need someone to yell it from the mountaintop. You need people to understand, to connect with, sing its praises.
And this started for us 9 years ago, when we were living in Detroit. The fact that you feel us speaking to your population is because this was birthed from that population. Yeah. Because I was working at a fitness club in Detroit. Dale was working at a hospital in Metro Detroit that was, right in the crux of metabolic disease, of type 2 diabetes, where, you were talking 75% of the patients. Along
with end-stage kidney disease. It was pretty pervasive. But yeah, I think after seeing, so much, going on, working in certain communities, you kind of say to yourself, like, what's the end point here, right? And then you kind of say, like, well, how do we actually maybe go back and get in front of the starting point of all this? How do we change? How do we change before we even, jump off into this like pool of just disease, and it just kind of snowballing, you know?
Like I've always said as well, it's just the medication is masking the problem. You're not curing it. We're not reversing it. Right. So going backwards, like Dale said, is essential.
Yeah. And kind of kicking out some of these barriers where it's like, well, it's like we're saying, like, okay, so like, you want me to do this and that, like, how do you expect me to do this? Well, we've kind of now we've kind of figured out a novel way to do it. And I think that if we can kind of dissipate and dismantle those barriers, whether it be like, availability or economics, then you're really speaking to people and empowering them and enabling them to help them make good decisions.
This is really,
I think this is so exciting.
Yeah, it's actually really interesting because even as I'm listening to this, and I think so many people are bombarded with so many life decisions, right? Trying to figure out, to your point, what am I going to eat? What am I going to cook? A lot of times they only have 10, 15, 20 bucks, right? In hospice, we see a lot of these things. When we're talking about things like diabetes, whether they be hereditary or whatever, right? Should we really be starting? Like, should I be starting with my 3-year-old? Should I be getting him on the right path? Or is it something I can wait till I'm 30 and 40 to do?
You start now. Absolutely. I mean, I would say start in the womb if you could.
Yeah.
Absolutely. You set the tone, because kids under 2 actually should not be having any sugar. So, and under 1, 0 sugar. And so if you're already introducing sugar at that stage, then it is a drug for them.
Changing their brain chemistry.
And when you say sugar, because people are going to say it, so I'm just going to go ahead and ask, you don't mean fruit, you mean like candy.
Straight up.
White sugar, yeah, or soda, however, whatever sugar is contained in, absolutely. Absolutely.
So this, I guess for us, for this conversation and figuring out how are we going to help the next generation, right? What do we leave them with? What is it? Is it nutrition? Is it fitness? Is it the insurance? What is it from you all's perspective? Me, I don't know how, I'm 37, right? My 3-year-old. What is it that we need to be focused on? Then if you had to pick one thing, we only have X amount of hours because our careers are crazy. If you had to pick one thing, what is that one thing and why?
I would say, personally, like parent like you're in like the 1950s, where there was no fast food. Kids went outside to play. They weren't sitting in front of screens. So as a general rule, like go back to the 50s. Like they were doing something right back then. You looked at ingredients and there were maybe 3 ingredients. It wasn't, and you could pronounce all of the ingredients,
sure.
Right?
And you prepared meals and you sat together as a family. That's how I envisioned the 50s were probably,
But there was a huge difference still in the 50s and today, right? For instance, most families didn't have 2 people working, right? So you had gender roles. You had a man who had a job and a woman who did that. So we don't have that anymore. So how do we still accomplish this?
I mean, listen, our household is not every household, but I'll tell you what we do.
Sure.
I'm actually a pretty good cook.
Okay. That makes life easier. Okay.
And listen, there's some nights I know, like she's had a crazy day, and I'm like, I got off early. Like, I'll make dinner, I'll clean up. Like we have to share those roles. If she's at work and then so am I, what's my excuse to not know how to cook and clean? A few days a week, just to keep with the consistency of this plan that's important to us, which is let's cook nutritious food. Let's set a good example. Let's sit down with our kids and eat, and do these things. So it's not so much, you talk the talk. We want to walk the walk as well and lead by example.
So I appreciate that. And more than you all know, your voices, because of your expertise, you're not just ChatGPT, you're actually giving someone real hope. And I think that's what the beauty of what you all are doing, whether it be through Prado or your other venture where someone can pay $29 a month. And the reason why that is so important to me, because I do see that $360 a year, which is essentially the cost of your program, is less than the cost of 1 month of insurance for a lot of people. And again, you're not saying cut that out, but you are saying if we can help you, we will help you. And it's something that can be done virtually, correct?
It's all virtual. Yeah. And our philosophy, going back to like the one thing really, I think a lot of it comes down to the food, because if you take the time now, while it's daunting, like you're tired at the end of the day, and taking 15, 20 minutes to prepare that food may seem like a big burden, but this is time. We always look at the time that you invest now as the time that you're going to get back. Right. Okay. Right. So we are big on. I
always say, choose your hard.
Oh yeah. That's his line.
Choose your hard.
I love that. Something's going to be hard. Something's going to be hard. It's either now or later.
That's exactly. Choose your hard, and also, again, not to get caught up on the, on all the lines here, but wise man once said to me, and I love this one, is probably my boss said it: don't let perfect get in the way of good either, right? Just start somewhere.
Just start.
And you're going to see the returns. You're going to feel better. Maybe you'll look better, and you're going to say, you know what? I want to do more. I want to do more. This is the direction I want to take things. And I think it takes some time to get in with that mentality, but that's where the sustainability and the durability of a plan put in place really holds. You know what I mean? When you kind of going back to like what we were saying about fads, you push people off the deep end, and they're drowning. They don't know how to swim in the shallow end first. Mm-hmm. Let's build up towards something that is durable and sustainable for life, for a better life.
Okay. So I want to say, for me and everyone that's going to watch this, I cannot thank you all enough. I think for so many people we feel like there's a disconnect between doctors, lower class, middle class, and trying to figure out, or nutritionists, how can we afford these things? What can we do to get there? And you all creating a product that, to me, is inclusive of all is super important. So Dr. and Mrs. Stern, I thank you for that. If you could leave me, though, because you didn't say it yet, and I got to get it from my people, Mrs. Stern. Oh. I need a sample plate. Give us a sample plate, right?
Sample plate. Okay. Sample. And one more thing I wanted to add in, another thing that we want to offer your community is just, if you take anything away, just check out the comments that we're going to drop the link in, which is just 10 essential labs that you should be checking, because it's always important to know what's going on inside your body. And there are things that, you can walk around day to day with, feel good about, but you don't necessarily know what's underneath the hood. So 10 essential labs we're going to give your community. So perfect plate. I mean, that was my lunch just now. So I accidentally bought chicken thighs. I normally buy chicken breasts, but they were damn good chicken thighs that we grilled on the barbecue. Some sweet potato mixed with quinoa. And then I had grilled peppers, asparagus, drizzle olive oil, and Cholula on top.
That sounds very expensive, but it sounds delicious.
Honestly, it's under $10 a plate.
Probably.
Yeah.
Really?
Yeah, absolutely.
I got educated today. I really appreciate you guys. This was the greatest interview I've had in a while. It's rare that I go into an interview and I don't learn something. It's also rare that I learned so much. So I really want to thank you guys for coming, and I really appreciate your time.
Thanks, Henry. Yeah, it was great.
So much fun.
Thanks, guys.
Have a great one.
All right, bye-bye.